Okay, welcome everyone. So the topic is antenatal obstetric complication. Is the word antenatal means before birth of the baby. Obstetric complications. What obstetric complications can be developed like polyhydramnias, oligohydramnias, and pulmonary thromboembolism. And there are a lot of multiple complications which can develop in antenatal period. So in this lecture, we will look at those complications of antenatal. Now, polyhydramnias, and it is a condition which is characterized by increased amount of amniotic fluid greater than 95% of the amniotic fluid, that is known as polyhydramnias. It is defined as amniotic fluid in index exceeds greater than 25 centimeter, and severe polyhydramnias is usually associated with a fetal abnormality. If massive uh, amniotic fluid is greater than 40, amnioreduction drainage excess the fluid, so polyhydramnias develops. It is associated with the diabetes mellitus and needs urgent investigation of glycemic control is optimized. So it is associated with the diabetes and it needs urgent treatment, polyhydramnias. And there are different causes of polyhydramnias include fetal cause and maternal cause. Maternal causes include diabetes of the mother. Fetal causes include increased urine production. Maternal diabetes. Twin to twin transfusion occurs. Now, twin to twin transfusion is a condition in which twin pregnancy, one fetus is receiving more blood while other is receiving less blood. One fetus will be polycythemic and another will be anemic, and one will be polyhydramnic and another will be oligohydramnic baby. So this is twin to twin transfusion when the both of the twins share the same distribution of the blood. That condition is known as twin to twin transfusion. Now the another condition which contributes to the polyhydramnias is fetal hydrops, and the fetal causes includes inability to swallow amniotic fluid. Now what happens, let's suppose this is fetus and the fetus excretes swallowing the amniotic fluid and then excreting it. So in this way the circle occurs. But what happens when fetus is not swallowing amniotic fluid? That fluid will be accumulated and condition of polyhydramnias will be developed. It is because of duodenal atresia, anencephaly, or neuromuscular conditions. Fetal will not swallow the amniotic fluid and polyhydramnia will be developed. So in this way this condition develops. The complications of the polyhydramnias, there are the same preterm delivery are the due to uterine overdistension, because there is polycythemia and increased excessive amniotic fluid. There are more chance of the baby to be delivered before 37th week of gestation, so that is known as preterm delivery. Male presentation of the baby can predispose to the condition. Maternal discomfort and other causes of the duodenal atresia associated with the trisomy and different diseases. So these are the complications of the polycythemia. Another antenatal obstetric complication is oligohydramnias. Oligohydramnias refers to decreased amount of amniotic fluid less than 50%. Oligohydramnias defined as the amniotic fluid index is less than 5%, 5 centimeter, and the causes are the renal agenesis, multiple cystic kidneys, and posterior urethral valve uh, problems. Now let's suppose this is fetus. As I told you before, fetus swallows amniotic fluid and then excretes it. But when there is the problem in excretion, fetus is swallowing but not excreting, which reduces the amount of amniotic fluid, and condition leads to the oligohydramnios. So in this way it occurs. Now the another complication of the antenatal obstetric is a venous thromboembolism. It is leading cause of maternal morbidity. Thromboembolism occurs because of amniotic embolism and amniotic fluid embolism dislodge into the lung, and there are different complications occur. Increase in clotting factor, decrease in protein C and S. It occurs maybe deep vein thrombosis or from pulmonary embolism, and patient may die because of these complications from pulmonary embolism or deep vein thrombosis. So risk factors are maternal age is greater than 35. If female is obese, then there are chances of development. Previous venous thromboembolism, smoking women, and thrombophilia is a group of conditions that predisposes to the thrombosis and formation of the thrombosis. Are deficient anticoagulants can lead to development of thrombus, and That thrombus will dislodge into the lungs and the patient may die because of pulmonary embolism. And deep vein thrombosis is the unilateral leg pain, swelling on the left side associated with the redness and tenderness, and then that thrombus dislodge into the lungs and develop into pulmonary embolism, and that presents with the dyspnea, pleuritic chest pain, and tachycardia will be there, raised JVP, syncope, and collapse of the patient will occur because of decreased supply to the brain oxygen. And in this way, this patient presents. So the best initial test will be deep vein thrombosis, will be ultrasound Doppler, and proximal leg vein included in ultrasound Doppler like popliteal and femoral vein, and superficial and deep iliac vein will be there. ECG, ABGs, chest X-ray, and pulmonary embolism can also help in diagnosis of the pulmonary thromboembolism. Most accurate test will be deep vein thrombosis for the CT venogram. Contrast CT venogram is the most accurate, but we often prefer to do ultrasound Doppler. So in this way, and the treatment for this dreadful condition is heparin anticoagulant, and a low molecular weight heparin is preferable. Subcutaneously it is given, and monitoring of factor 10A should be done. And unfractionated heparin is also the treatment which is given IV, and low molecular weight heparin is preferred in this disease. And in this way, heparin and warfarin should be started for the venous thromboembolism. And the complications, no, this is not related. So that was our antenatal obstetric complications. In this we discussed polyhydramnias, oligohydramnias, and pulmonary thromboembolism. These are dreadful complications of antenatal obstetric, and a patient must be screened for this disease, must be properly kept on follow up in order to have safety of mother and safety of baby. So this was today's topic. In next video we will discuss another complication of the pregnancy. So stay tuned, do subscribe to my channel, and always work hard.